The chair now recognizes the gentlelady from New York, Ms. Rice, for 5 minutes.
Thank you, Madam Chairwoman. Mr. Cuccinelli, during the past public health crises like Ebola and H1N1, the Department of Homeland Security played a pivotal role in a clear and coordinated federal government response. With the coronavirus, our state and local governments have stepped up to fill this role. States like New York have had to respond quickly to deploy emergency management and to work with local partners to keep our citizens safe. They, instead of your agency, are at the front lines of this outbreak. So, for some reason, it appears, and maybe you can enlighten me if I'm wrong, that DHS has not been on the front lines like they have in prior epidemics. And so could you clearly state what DHS's role has been in responding to the coronavirus and what you see as your role going forward?
Certainly. As we move further and further away from containment, which is where the Department of Homeland Security has a significant role, and into mitigation, which we've been doing for weeks now, as Dr. Redd has referenced implicitly a number of times, the frontline folks, and just pure volume of numbers, are your local and state public health authorities. We're following the pandemic plan put in place 2 years ago, which was the most recent iteration of that plan, and it in fact calls for extensive cooperation with the federal government supporting local and state efforts. The sheer number of medical and healthcare professional personnel required to address a pandemic like this puts us in the position of necessarily relying on state and local officials to be frontline fighters in this effort. And I'll give you an example. When we saw the Grand Princess problem developing off the coast of California, we had a unified command set up between the Coast Guard, CDC, California. But in practical terms, because those people were going to land in California, were most likely to be impacting California healthcare facilities and capacity, California very much had the lead and did a great job with it. And we're being very careful not to step on states or to tell them what to do. We are partnering with them as best we can.
Okay, thank you. I'm just going to stop you there.
Sure.
It's now being reported that in my home state of New York, we have almost 200 cases of the coronavirus, which makes it one of 3 states with the highest number of cases. Before this hearing, I spoke with the head of the Department of Health in Nassau County, which is on Long Island, which my district is fully encompassed in. And I asked him, I said that I was going to be at a hearing with you, and I said, is there anything that you need that you don't have that the federal government can provide? And he said, what we really need, because now they're seeing more significant cases of community spread. For instance, in my district alone, the number of infected people has quadrupled since Sunday. Right. So I asked him, what can the federal government do? And he said, what we'd love is some guidance as to what public events should be canceled, what public events should not be canceled. Dr. Fauci testified today that large sporting events should be banned. So what is your guidance? They're looking to the federal government for some guidance on that issue so there can be a lack of, so we don't increase the panic and that states are not doing different things and getting people all riled up when they don't need to be.
Well, in the Department of Homeland Security, we essentially operationalize CDC guidance. We look to the CDC's guidance as well, and because of the novelty of this virus, it has been changing. And I know I'll turn it over to Dr. Redd, but...
Well, let me just stop right there. Okay, so I will follow up with that question. I just wanted to ask you, Dr. Fauci also said, quote, we would recommend that there not be large crowds. Would you consider a political rally in an arena that is filled to capacity with between 8,000 and 12,000 people? Would you consider that a large crowd?
We would consider probably anything over 1,000 people a large crowd.
Okay. Doctor, if you could, the question that Mr. Cuccinelli...
Yes, I think that the purpose of the gathering wouldn't determine whether it would be,
Well, let me tell you, do you agree with Dr. Fauci on that, that there should not be, that he said we would recommend that there not be large crowds? Would you recommend with him?
I would.
Would you, Mr. Cuccinelli?
Again, we look to the medical professionals
I'm asking
for that
your opinion.
guidance.
You are in
I'm
this
sorry,
with
I'm not going to give
DHS.
you my opinion. I'll tell you the opinions I look to operationalize
So
when
do
we
you
do our
agree
job.
with what
Dr.
Dr.
Red
Red is saying?
Well, I certainly
Yes or
look to
no?
his employer for CDC.
Why can't
for
you
where
answer this question?
Well, I'm sorry, I don't know that
Is
it's
it because
a
the
can.
president has said that he has no plans to not have people, thousands of people, gather together in large crowds? Is that why? Because
So
Dr.
when
Red
we
said
have
it in
this
2
decision to
seconds that
make-
he agreed with Dr. Fauci. Can you please give me a yes or no answer? Do you agree with Dr. Fauci when he said we would recommend that there not be large crowds?
I'm not prepared to do that.
Okay, that's quite unbelievable. I think my time is up. Thank you, Madam Chairwoman.
The chair now recognizes for 5 minutes.